Thanks again, Derek, and welcome to the 18th Annual Problem Gambling Conference. My name is Nick Ciafani. I work for the Ohio Lottery. I'm the Chief Legislative Officer. So just as a quick background, deal with a lot of the elected officials, our legislature, our governor's office, external stakeholders, interested parties, and trying to deal with all the fun stuff that happens in Columbus and throughout the state of Ohio, how it can affect the lottery. Before that, I worked for members of Congress for 11 years. Just as a background for the Ohio Lottery, we have over 10,000 retailers. We regulate the 7 racinos throughout the state of Ohio, and we take our regulations and requirements for problem gambling very seriously. When we are talking to legislators down in Columbus, they often ask about problem and responsible gambling and are always interested when we talk about it and bring it up. And some of them have an idea, and other ones do not have an idea about how integral we are involved, how we have staff dedicated to the issue, and how we take this issue very seriously. But I also want to say we welcome feedback for what we're doing right, what we can always improve on from this community. We do want to keep it fun for all Ohioans, but it's a two-way street, and we always want to hear from you. So with that being said, I have the distinct honor and privilege to introduce Tristyn Ball. She leads the Division of Prevention and Early Intervention at the Montgomery County Adams Board. She also serves as director for the Montgomery County Prevention for the Ohio Disaster Relief Program. Tristyn is passionate about health equity, and she works diligently to impact policies, systems, and environments in order to improve behavioral health outcomes. She previously served on the board of directors for Problem Gambling Network of Ohio and is current member of the Ohio Problem Gambling Advisory Board. Tristyn is a licensed social worker and an Ohio certified prevention consultant. She received her master's of public administration at Ohio University and is currently pursuing her doctorate of public health at Indiana University with an emphasis on public policy. Tristyn will be presenting on the Community Conscious Retailer Program. This program engages in lottery, tobacco, and alcohol retailers implementing evidence-based prevention strategies within their stores to create healthier communities. And just 10 minutes ago, I found out Tristyn is an avid runner and attends the Arnold Classic every year. So with that being said, it's my distinct honor and privilege to introduce Tristyn Ball.
Thank you. All right, well, welcome everyone. I'm going to go ahead and share my screen. Let's go ahead. All right, can you guys see it?
Yep, looks good.
All right, thank you. All right, so today I'm going to be talking about engaging lottery retailers in environmental prevention practices. So really, I've been engaged in some level of work when it comes to gambling for a while now in the field of prevention. And what we've really been looking at here, at least in Montgomery County, is ways to engage the community at large, really, in environmental practices. There had been some work coming out of the state a while back around, I would say maybe 2 years ago, around how we engage coalitions really in work around problem gambling prevention. So when I was managing the Montgomery County Prevention Coalition, really we came together with our coalition members and we really looked at how we integrate some of these problem gambling prevention practices into our standard coalition work, right? And we wanted to kind of think outside of the box. What is something that we can do that is really substantial? We work on alcohol policies, we work on tobacco policies. So we wanted to look at what can we really do to impact lottery retailers. So we, as any good prevention practice should begin with, we started with collecting data. So I'm going to walk you through kind of our process on how we collected some of our data and then the program that we really ended up with here at the end. So so in March of last year, everything shut down. And all of our prevention providers, I work at the Adams board. So all of our prevention providers were like, hey, we're out of schools. We want to get more involved with the coalition. Right now is the perfect time to do that, right? And we definitely looked at that and thought, what a great opportunity for us to do some data collection. And I saw Dr. Marquita Robinson is on the call today, and her staff, as well as a couple of our other providers, actually really stepped up and helped us do an environmental scan. So at that time, we weren't doing scanning inside stores. We went ahead and looked at the exterior of stores. So what that really meant was we were just looking at the outsides of stores, seeing how many lottery advertisements they had, how many tobacco advertisements they had, how many alcohol advertisements they had, if they had any kind of signage saying that you have to be a certain age to purchase age-restricted products. And then we were looking at total sign coverage. So the way that we did this was we set up a Google form that just asked about pretty much the number of signs for all of these different things. And we went on the Ohio Liquor Commission website and we looked for C1 and C2 permit holders for alcohol. So what that means is that they serve carryout alcohol. So this is going to be a lot of your convenience stores, gas stations, supermarkets, things of that nature. And then we went ahead and there were 361 of them in Montgomery County. So that doesn't necessarily mean that it's comprehensive of all tobacco and lottery retailers, since we only went off of alcohol retailers, but it gave us a pretty good picture. So we went ahead and we looked at the storefront, just the storefronts, to see what it looks like. And where that really came from was the fact that there's a lot of research that has been done on alcohol advertisement and tobacco advertisement and early initiation of youth use of both of those products, dependent upon the amount of advertisement that is in the stores, like near schools, near where they live. If they're walking past a convenience store that is just plastered with advertising every morning on their way to school, then advertising works, right? And we have research to show that. So that's why we were really looking at it. We were seeing if there were disparities in certain communities that we maybe needed to target a little bit more. And okay, so then we collected all of that, I would say, in a matter of maybe 2 months. And then it was probably another 2 months to really evaluate that data and really look at where we needed to target our efforts, dependent upon these environmental scans. All right, so our findings were not surprising. Unfortunately, so what we saw was tobacco, alcohol, and lottery advertisements in like the 45405 zip code, which is West Dayton, if you're familiar with the Dayton area at all. It's historically disadvantaged community. Then 45403, which is East Dayton, again, a pretty low income community, where you see a lot of those disparities. And then 45404 Old North Dayton, so really staying around the centralized, like the downtown area, just right outside of downtown Dayton, which is where we see, as I said, a lot of the disparities there. And then they were least prominent in 45419. If you're familiar with the Dayton area, again, that's Oakwood, Kettering, Centerville. These are areas that generally are more affluent, have more resources. So, and I went ahead and I added the pictures here. You can see here on the left, this is, I promise you, a real picture of I believe it was the 45403 zip code. And you can just see that it's plastered with advertisements and the disparity that exists as compared to the bottom photo there, which is in Centerville, a speedway. You can see that there's very minimal signage, and the signage that is there is really for food items. So the youth that, if they're walking by that store, aren't getting the same messages, right? All right, and then I'm not going to go over all of this with you, but I did just want to share the data that came from this countywide survey. And so what we found here was that there were about, on average, about 2 alcohol ads on the outsides of stores, almost 4 tobacco ads, and just over 1 lottery ad. But based upon the zip code there, again, as you kind of look through them, you can see like here, the tobacco ads in 45405, there's almost 9 per storefront, which is a bit excessive. And then you can look all the way down to, 45429, not even 1 on average there. So just something to kind of think about. Obviously, if you want to do this in your own communities, I am happy to share our surveys with you guys. And it's a great activity for coalitions to go out and, get members collecting this data, as well as, if you have any prevention staff or staff that are just really looking for a volunteer opportunity. I think this was great data, and we definitely learned a lot from it. All right. So we brought this information back to the coalition, and we decided we needed to address storefront signage, right? We see the disparities that exist. We see that, when you're getting into the economically disadvantaged communities near the city center of Dayton, we had so much more storefront coverage. Then we specifically needed to target the zip codes that have a signage policy in place. So what we found, so we took this to the policy and advocacy committee of our coalition, and we're like, all right, we need a policy, right? So this is unacceptable that we have so many stores that like you can't even see inside of them. We had police officers at this meeting, and they said that creates a public safety concern. If they're responding to a call, then they can't see inside to scope out the situation. And obviously, based upon the research that we've seen, it normalizes the use of alcohol, tobacco, and lottery for the individuals that live in that community, for youth that are maybe just passing by, maybe purchasing items from those stores. So that was something that we really wanted to look at. And what we found actually was that the city of Dayton has a pretty strict sign ordinance that's just not enforced at all. So what we had initially proposed was recommending a policy based off of the Lee law in California. And if you're not familiar with the Lee law, what it does is it has a certain number of restrictions for alcohol retailers or alcohol establishments. And one piece of the Lee law, and again, this is a statewide policy, is that they can only have 33% window coverage. So that is very specific to windows, not necessarily storefronts. But we figured that was somewhere to go, right? We're driving past these establishments and you can't see inside, which is problematic. So again, we found out that the city of Dayton actually had a 20% coverage. So it was far more strict than even the Lee law. Sorry, hold on real quick. I want to show you just a couple of resources, for those of you working in communities. I know it can be hard to really understand your local city ordinances. So there are actually 2 different resources that you can use. They are both, they're both really places where you can find all city ordinances in different municipalities throughout the nation. But you can find Ohio's here. So I have pulled up, let's see if this works here. All right, so I have pulled up the code library here for some Ohio cities. This one's going to have more. I'm happy to send out this information as well. So it's codelibrary.amlegal.com. You can click on Ohio. and we went through this process. So our obviously our scan looked countywide. So we had the city of Dayton, which was the area that we determined we needed to spend the most time on. But also there are, 15 other municipalities within the county that we needed to look at as well. So I'm just going to kind of show you how to go through this here as you're looking through. I'm sure you're seeing some cities in your county. I'm just going to go Huber Heights. So Huber Heights, if I look through here, and we were focused on sign ordinances. These are not always very intuitive. So I'm just going to walk you through kind of how we get to that for Huber Heights, so you can look at ordinances in your own cities. So here you have all of your different options. So where did I find that there? I went to Planning and Zoning Code because it is a zoning code. It is Title 9. Here is signs, chapter 1189. Again, this is dense, guys. I know that. Unless you're really interested in city codes like I am. We have a city planner who's the president of our coalition. So he understands all of this and he's gotten me really excited about it. I think that that's something that you probably have to get used to and learn to get excited about this stuff. And then we go through and you can just see here all of the different things that they focus on. I'll tell you, the city of Dayton, some of them are a little bizarre that they have those restrictions. But Huber Heights was pretty normal here. So anyways, I'm not going to go too far into this. I just wanted to show you guys how to find this information should you ever need it. All right. So the issue was really in the city of Dayton, it was an issue of non-compliance. So we're sitting at one of our committee meetings and we're like, okay, so we need more enforcement, right? Like we just need to find these stores. We need to, make sure that we are hitting them where it hurts, just stack on the fines. They'll start paying attention to these signs. And we had somebody come in and they were like, no, that's not the way to do it. Like we were to the point where we're like, okay, this is going to generate so many fines that we're going to be able to pay for a new position at the city. Like we were ready to like charge forward on this. And this is the power of coalitions, because we had so many diverse perspectives coming in. They were like, that's not being a good community partner. A lot of individuals, we found a lot of store owners don't even know this information, right? They're not looking at zoning regulations. At least in the city of Dayton, when you open a store, it's not like you're given a stack of things that you need to pay attention to. And if you are, you're certainly probably not paying attention to signs, right? So anyways, what we decided to do then was we really looked at like, how can we support these store owners, right? Rather than being punitive, there are a lot of stores that want to be good community partners. So we decided that we were going to take a restorative approach, and really reach out to those that wanted to be good community partners, and kind of normalize those behaviors in the communities, and then have it more widespread. So the Policy and Advocacy Committee of the Prevention Coalition decided that they wanted to really begin targeting some issues with these stores. So we decided upon 3 of the 10 here. And the first one was reducing local youth exposure to alcohol advertisement. We had the research to show that was really problematic. And then we expanded that to fit tobacco and lottery as well. Reduce youth access to alcohol. Again, that's one that we expanded to tobacco and lottery, making sure that these products were locked up, that youth weren't able to just kind of grab them, making sure that youth were being carded for these products, and then supporting alcohol age compliance checks to increase compliance, obviously. And then that went with tobacco as well. We haven't really explored that for lottery. I'm just going to be really transparent on that. So those were the three that we really decided that we wanted to look into. All right, so we wanted to look at how do we support retailers, right? So we've determined we're not taking a punitive approach. We want to help retailers because it was coming out, you know, we have police officers and coalition members really going out into the community and asking the retailers, you know, do you know about these laws? Do you know about these restrictions? Do you need support? And they seem, there were a couple exceptions. I'm not going to lie on that. But for the most part, these retailers did want the support. They wanted to be good neighbors. You know, they don't want kids to be using substances underage or gambling underage. They needed a little more support. So really 5 areas that we wanted to focus on with this community conscious retailer program was reducing overall advertisements and other signage, internal and external to the store to increase public safety. And this created a really good partnership with law enforcement just because they've seen the success of signage time and time again. So that included, like I said, the storefront window advertisement, but then it also included like your point of sale purchasing, right? And then looking at product placement, decreasing the accessibility of age-restricted items for those under the legal age of purchase. This actually included things like for the lottery, making sure that lottery kiosks were within sight of, or the line of vision of clerks, you know, making sure that there aren't tobacco products that are out, making sure that, you know, any kind of alcohol is really being monitored as closely as it can be. We wanted to focus on transactions, so ensuring transactions follow protocol to decrease risk of harm to individuals. That's carding. Procedures, retailers have clearly defined procedures to assist store personnel in understanding expectations around the sale of age-restricted items. So something that kind of came from our discussions with these retailers was, what do I do if somebody's underage? Like, how does that go? What if somebody's clearly intoxicated and coming in to buy alcohol? How do I refuse a purchase? And that was something that they felt uncomfortable with. And then focus on workplace policies. So making sure that, you know, there are policies set in place for the standards for employees. And I'll go into that a little more, but those were really the 5 areas that we wanted to focus on. So I will show you what we've drafted, but what really came from this was the fact that what was the incentive for retailers to do this, right? We found out that tobacco retailers actually pay, they pay the store owners or store managers to place their ads. And it's almost very competitive. Like they'll go and they'll rip down other ads, they'll put theirs up, they'll plaster them beside them. And not even taking into consideration some of these local city ordinances, which I thought was interesting. It's my understanding that the alcohol establishments were doing that too. So we wanted to know, you know, I can't buy out tobacco retailers. I'm going to be very honest, right? So we wanted to know, what could we do to incentivize these retailers? So one of our coalition members, he is the head of one of our neighborhood business associations. So he was talking, and he said he was talking to his business association, and the biggest thing that came out was they wanted, the incentive that they wanted was advertisement. So he said the best thing that we could give them was a billboard right in the middle of their in their community. So these are neighborhoods that we're focused on, but then also taking into consideration some of those cities, you know, doing targeted advertisements for social media. And here I can advance the slide to kind of talk about what we did here. So there are different tiers that I will go into showing levels of compliance really to this program. So what we found was in terms of like bronze level. So if they met, and this is really just like what is legal and, you know, making sure that we're adhering to zoning ordinances. So what we decided with bronze level was that they would get 5 newspaper advertisements. We would do a press release just showing that they're a community conscious retailer, get a news story out of it. And then we have certain materials that I'll go over and show you, just showing that they're a community conscious retailer. Silver level incentive, we did 3 months of social media advertising targeted to the store zip code and surrounding zip codes, promoting that the retailer is involved in the program and highlighting their store and the retailer's commitment to a healthy and safe Montgomery County. They got to choose their social media platform. And then we would, I didn't go over this in bronze, but then we would go ahead and provide any support, financial support that they would need to get to the next level of this tiered program. And I'll go into that a little bit. Gold level incentive was 3 months of Google advertising targeted to the store zip code and surrounding zip codes. Again, just showing that they're a community conscious retailer. And then again, the press release, and then the platinum level would be 1 month of billboard advertisement of the retailer's choice. So they got to choose, you know, what billboard they wanted. If there's one, you know, near their store, they could choose that one. If they wanted one on, you know, Interstate 75, they could have that. It was really up to them at that point, as well as an additional 3 months of social media advertisement. So the way this works is it builds upon itself. So let's say we have an incredible store. This hasn't happened yet, but I'm hoping in coming years that we will have this. We have an incredible store that comes in at gold level. Then they would get all 3, and then we would help them achieve the platinum level. So I'm going to go ahead and start going over what these levels look like, and how we're kind of rolling this out here. So sorry if you can't read this. I can send this this file out so everybody has it. Actually, it's on, if you go to preventionmc.org, you can click on the Community Conscious Retailer Program and get all of this information as well. So bronze level, this is a lot of, you know, what is just required for like basic regulations. Okay, so the storefront window signage shall not exceed 20% of the windows. Again, like that's something, at least in the city of Dayton, which is where we're targeting right now. This is something that they need to be doing anyways, just to meet their city ordinance. Age restrictions posted, you know, age of sale, weak card signs. Making sure advertising for alcohol, tobacco, and lottery is at least 3 feet from the ground. We found some research just showing that you want that up higher, so that, you know, younger people aren't constantly being exposed to those images, and really normalizing that behavior. And then gambling helpline posted. So I actually don't believe that this is a requirement. I could be wrong on that. But we just know that it's good for individuals to have resources. And I'll get into a little bit about what the lottery is actually doing, that we will be promoting within Montgomery County. In terms of product storage, making sure that the lottery kiosks are being monitored, that tobacco products are being, you know, either behind the sales counter or locked. That includes things such as like any kind of pipes or any kind of other paraphernalia items, making sure that they're not easily accessible. making sure all lottery products are kept in a place where they're not like easily accessible to customers. So if they're on counters, making sure that they're facing the clerks, making sure that they're locked up. That's pretty standard, but we wanted to just make sure that that was what all of our retailers are doing. And then ensuring that there is no tobacco self-service. So there are a few bars in Montgomery County that actually still have tobacco vending machines. We haven't seen that with any of our establishments that have carry out alcohol, but again, just something we want to keep in mind. So transactions, all clerks need to be scanning IDs if an individual appears to be under the age of 30. So this is where I was talking about the incentives. We had individuals, or we had stores that didn't have ID scanning capabilities. So we had the funds to actually purchase ID scanners for them to just make sure that that wasn't a barrier for them being able to implement this program. Oh, and then another support area would be, when we're looking at tobacco product storage, making sure that if they don't have locked cases, we're purchasing locked cases for them. We want to make sure that we are providing them with everything they need to have a safe and secure retail establishment. Making sure that they have passed all of their compliance checks and that they're not selling age-restricted products to someone underage. This is something we're actually still looking at. Sometimes you have it where a young person will sell underage, and we didn't know if that was necessarily appropriate to be so punitive that disqualifies them for this program. So we're going back and forth. If you type in the chat or you want to reach out to me and tell me what you think about it, I would certainly appreciate any input. But we did want to really make sure that there are some retail establishments that consistently fail their compliance checks. And we would want to provide support to them, but not necessarily, have a press release with our name on it saying that they're a community conscious retailer. Making sure that the store has a procedure to recognize fake IDs. We found that that's something that, we thought was very, very common, but maybe not always in the retail establishments here locally. And then the store has a procedure on how to reprimand employees that sell age-restricted products to individuals under the legal purchase age for tobacco, alcohol, or lottery. And so, again, not necessarily being punitive, but making sure that there are some measures in place to really make sure that that doesn't happen again. All right, I don't know why that. Oh, okay. So then there's a gold, bronze, silver, and gold, and then platinum level. So there's 4 levels here. I cut out gold and silver. So I'm going to show you what our platinum level looks like. This is, if a store has it all. Again, external storefront signage, we wanted to make sure that that's pretty limited. Point of sale advertisement, there are no advertisements of age-restricted products within 10 feet of the sales counter. Age restrictions have to be posted. Eye level advertisement, we bumped that up a little bit, needed to be at least 4 feet off the ground. So this is like your advertisements that you see on like coolers or, or just kind of around the store, right? Again, gambling helpline needed to be posted. Product placement, having your lottery kiosks be monitored, tobacco product storage, alcohol storage, lottery storage. Again, just making sure that all of those products are safe and secure and not readily available to young people to kind of grab and go away with. The counter space, the sales counters kept clear of products containing alcohol and tobacco. We know that a lot of our retail establishments here in Montgomery County actually keep their lottery products on the counter. So we didn't want to necessarily limit that because we found that would be a huge barrier for them in being able to enroll in this program. So as long as they were, facing the clerks and kept out of reach of the general public, we were okay with that. All right, again, tobacco self-service, making sure that, people that there's ID checks in place, that they're not serving themselves. Tobacco paraphernalia needed to be kept behind the sales counter or in a locked case. And all products containing tobacco, alcohol, tobacco paraphernalia, and lottery products are kept at least 4 feet from the floor. This excluded lottery kiosks and areas that are age restricted, such as beer caves. So a place where there's an actual barrier where people would have to enter. And then really looking at transactions, having ID scanning, making sure that, people are of age, sales hour restrictions, and then making sure that they've passed their compliance checks. In terms of procedures, again, looking at those fake IDs, looking at underage sales, and then the addition to that was intoxicated customers. So how they're dealing with customers that are actually intoxicated, and feeling comfortable not selling to those individuals. And then this has some workplace procedures, which is a drug-free workplace. We offer support for drug-free workplace here at Montgomery County Adamus Board. So that was a really good internal collaboration that we were able to take part in. And then a smoke-free workplace. So we have, again, somebody that specializes in those policies here at the Montgomery County Adamus Board, but making sure that, you have to be so far away from the establishment to engage in tobacco use. All right, so as we were talking through all of this, the retailers had said, like, what does this look like ideally, right? So if I were to set everything up correctly, and so we have here our interior retail setup guide. Obviously, it could look a little different than this, but you can see here you have your locked cases. Any products containing tobacco, nicotine, CBD, tobacco paraphernalia, or other paraphernalia, just making sure that that is all locked away in a case. We can see here, and it's behind the sales counter. Travel or airline liquor bottles, which are like those little liquor bottles, are kept behind the sales counter in a locked case. One thing that I actually found when working with other coalitions across the nation was the emphasis to really focus on those small liquor bottles. And they were finding in other communities that young people were pocketing them, which I guess I had never thought about, but that was one thing that we wanted to incorporate in here as well. Making sure that the sales counter is kept clear of products containing alcohol and tobacco, and then age-restricted products being at least 4 feet from the ground. As you can see here, and I'm guessing that this is pretty standard in a lot of your communities, making sure that, the lottery products, if they are on the counter, that they're just being locked up, having age restrictions posted and easily visible for individuals, just kind of having that visual barrier at the point of sale that can sometimes cause young people to rethink. So making sure that we have that information. We have our great responsible gambling material here posted next to the kiosk. Usually kiosks have something, they usually have the helpline posted on them, but we wanted a little more. So obviously you could use those materials. The Ohio Lottery has I believe, Keep It Fun materials. So that could kind of go either way. You can see there the lottery kiosk is easily visible to the cashier. So she can view that if there is a young person, maybe, a 12-year-old that goes up to it and goes to purchase, she could intervene in that case. And then as you can see, there are no advertisements of age-restricted products within 10 feet of the sales counter, with the exception of product or materials not exceeding the brand logo. So that was a big thing that came up from retailers was, if you look at your wall behind the retailer, usually you're going to have like your tobacco products, and you're going to have like a large like camel kind of banner, right? And so we decided, is that an advertisement? Is that not an advertisement? And we had determined it's not. I think, you know, as you look in your own communities, you can kind of determine that for yourself. There wasn't really clear research on that, at least not that I found, of that being necessarily harmful. So I didn't want to limit that at that point. And then all advertising for age-restricted products throughout the store are at least 4 feet off the ground. And what the retailers really wanted to know was, you know, what are the benefits of this program? Why am I doing this other than getting this, you know, incentive for advertisement? So what we let them know was it actually helps in terms of public safety. You know, we have a great partnership with Dayton Police Department, and you know, really showing them that, you know, you have all of these signs on your storefront, and what retailers will tell you is, you know, it helps people, or they felt like it helped them, because then potential individuals that would potentially, you know, engage in criminal behavior can't scope out the store. But what police made the point of is, actually, if somebody, you know, does engage in criminal behavior in your store, it lets us see right in and see what we're walking into. So it helps keep those within the store safe. It makes it so like people aren't walking into that situation, right? And then also it helps the police from potentially being in a really dangerous situation, so they can scope things out a little better. We have a policy brief. We have a one-pager that shows how these initiatives actually decrease substance use among youth, and how it really helps to increase age of initiation, which most individuals on this call here know that we want to increase that age of initiation as much as possible. And then overall aesthetics, it just makes the store look better. We did a community-wide survey during National Night Out. Oh gosh, that would have been in 2019, where we showed 6 different storefronts, and we just had pictures, 6 different storefronts within Montgomery County. And we asked individuals, which one would you feel most comfortable shopping at? So they had all different ranges of advertisements. You know, some you couldn't even see inside, some were very clear. And what we found overwhelming was that Montgomery County residents, I'm going to say we probably had like 200 residents that we surveyed, wanted to shop at the one where they could see inside, where it had minimal advertisement on the storefront, and they would be least likely to shop at the ones that were plastered with advertisements. And a big thing that actually came from that was they actually cited the public safety concern, which I thought was interesting, because they felt like if they were to walk into that establishment, that they didn't know what was going on inside. And so I thought that was telling. We were able to put that information again into a one-pager that has gone out to retailers, just really showing them that, you know, there is public support for clearing up your storefront. So the Ohio Lottery actually has some materials that they are going to be dispersing to lottery retailers. So we have 5 easy ways to gamble responsibly. These are kind of rack cards that can go on the counters at point of purchase to get individuals thinking. They have window clings for gambling responsibly and where to get more information. So we will be working with the Ohio Lottery to, you know, make sure that we're including these materials into our tiered system, to make sure that, you know, there are all of those materials, and there's as many resources as possible, right? So obviously, if individuals have a problem with gambling, not gambling at all, but for those of those that don't, making sure that they are gambling in a responsible way to make sure that it doesn't become problematic. So I'll talk a little bit about just our cross-sector representation here. So the coalition really took the lead on this. The Policy and Advocacy Committee led this initiative and determined areas of focus based on that information that came from the environmental scan. So that was really important. We had we had prevention providers, we had treatment providers, we had the public health department, the business owners, kind of everybody that was part of this. And I will say, while I did probably the heavy lifting on the research of the initiatives that went into our tiered plan, the coalition was really instrumental in determining, what we wanted to look at. What are some of the problems that we're seeing within these stores? So then we were able to engage the neighborhood associations. The neighborhood associations in the city of Dayton have really good relationships with the business associations, as well as like local stores. So one of the neighborhood associations, Old North Dayton, here, obviously in Dayton, they were able to look at, who are these really good community partners that want to do better. And then they were actually able to engage one convenience store, which has been, I'll just say, rather problematic, and sits right across from the playground of an elementary school. So they were actually able to cultivate a relationship with them and recruit them for this initiative. The police department went out and actually talked to the retailers about this program and tried to recruit that way, and garnered a lot of interest actually just going out. There's a lot of really good community policing initiatives that are happening through the Dayton Police Department. And then here at the ADMIS board, obviously, the coalition was able to elevate this program in a way that we were actually able to provide a contract with a provider to go out and implement this program fully. So the public health department is our contracted provider for this initiative. All right. So I wanted to walk you guys through what this really looks like in practice. We sent out just kind of, like, if you're familiar with like weddings, like save the date, right? Like just getting a little bit of interest here. If you're interested in registering, this is where you're going to go. This is kind of what this program is about. And this went out, this goes out like long before the program initiation. And then this is the reminder. So this is, you need to make sure that you're registering, getting this information in for those that are interested. And like I said, this went out to 3 zip codes. Those 3 zip codes that I had initially talked to you guys about early on that were identified. The only exception was the East Dayton zip code. So we have actually partnered, and a lot of the counties that you folks are from may have this program as well. There's a program that focuses on convenience stores and it's like corner stores and actually getting healthy foods within them. So because the Food Equity Coalition and the Montgomery County Prevention Coalition are launching these 2 different programs at the same time, we didn't want to inundate these local retailers with too many programs at once. So if you are interested in rolling this out in your communities, maybe check with, if you have a Food Equity Coalition, a public health department, somebody that engages in that food access work. Just making sure that you guys aren't all going to the same retailers and trying to enroll them in a program at the same time. So we had picked an additional zip code that we were focusing on. And in the first year, just enrolling 10 retailers. This is a pilot program. We wanted to see how this went. Obviously, lessons that can be learned from it. I would give you all of our tips and tricks, but we are still rolling this out, and there have been delays due to COVID. So here in the end of June is when this program will wrap up. And we really start to look at how we're going to implement this next year, really looking for an expansion here. I think this is a really unique opportunity in terms of engaging retailers in ways that we generally don't do that. All right, so this is a mock-up of the Adamus board website. This is actually on the Public Health Department's website, but it's where store owners can go and look at what the community conscious retailer program is. Some of the things that will be included, such as the advertising incentive, the store safety upgrades, and then obviously the incentive of public relations, all of these press releases, getting, having the Adamus board promote them, having the public health department promote them, just really showing them, or showing the communities that that these retailers really do care and that they want to make an impact and be a good neighbor in their communities, which we found was pretty important. So also, there's a place for registration where they can register. It is not on this mock-up, but there is that as well. And then we're going to be building it out a little bit to actually have a feature for each of our 10 retailers that are engaged in this. Okay, and then this is, we obviously worked with an advertising agency. We have a mock-up of the billboard you can see down here on the left-hand corner. And I will say Big Dave's Mini Mart is not a real place. This was made up. We've had several coalition members be like, oh, where's that at? Doesn't exist. But I do think that they did a really good job of creating these materials. And then here is just a sample of what the Facebook post would look like. We've taken important new steps to keep our shopping environment safe for you and your children. Stop in today and shop in comfort. And then again, if, Big Dave's Mini Mart doesn't have a website, then we would link it back to our feature, just showing where they're at what level they're involved in the community conscious retailer. So if they're a bronze level, if they are a gold level, where they are in adherence to that program. And then we have, like rack cards here. That can be used as well. All right, and so we have, okay, so the one here on the left, this Big Dave's Mini Mart, this actually goes at the register. I think I have a photo of it, maybe. It actually goes at the register to just show that they're a community conscious retailer. And something that came from the coalition was, we know what a community conscious retailer does, what a community conscious retailer is, but does the community know? Like if I'm out shopping and I'm at a Speedway, and Speedway is a community conscious retailer, and they have all of these logos and emblems, what does that mean, right? So that's why we have, the little excerpt here about just what it is. This was an earlier version because it should be linked to the website as well for more information. And then you have a chalkboard here, and this is probably one of like the best ideas I feel like came out of this initiative in terms of advertisement is, all right, they can't have storefront advertising, but we decided that we would go ahead and do like the stand chalkboards. They don't look like this. This is just, a branded one that they have the community conscious retailer logo on. And what we are doing with that is, they can write any kind of specials that they have on it, clear up that storefront, making sure, that there's more visibility within their store, and having a more neighborly feel, just having the chalkboards outside. So our retailers were actually pretty excited about that, and we're pretty excited about that as well. And then you can see here, we have the convenience store. It's, again, this is not a Dayton convenience store. This is a mock-up. But you can see, there's a lot of visibility here. They have a transparent emblem that they're a community conscious retailer. we had talked about in the future doing it where we showed their level of adherence to the tiered system. But just starting out, we decided we didn't want to do that right away, because if we put bronze level, then that may show that, you know, they're not platinum, right? So moving forward, we will want to get a little more competitive with it. We want there to be a little more understanding of what the community conscious retailer program even is in the city of Dayton. So we did that. And then here you can see that there's a floor emblem just showing that they're a community conscious retailer. We've looked at things such as, you know, clings on freezers and posters and a little bit of everything. This is just what we've started with. So we are pretty excited about that. And then I'm finishing up a little early. This is all of my supportive research if you want to check that out. And then I am open for questions.
Thank you so much. Tristyn, before we jump to questions, I am going to launch our poll question just to verify attendance.
Okay.
And so that poll should be launched now. If you are struggling in viewing that poll question, then it may be because your Zoom is in full screen. So move your Zoom out of full screen mode and to be able to access that poll question. I'm also going to put the question in the chat box for those who still cannot see it, and you can feel free to engage in the chat as well. And I'll leave this up for about 3 or 4 minutes and pass it over to Mike Bizzelli to lead some question and answer.
Sure thing. Yeah, I'll get started. I mean, my first comments are this is super amazing and really involved. This is really awesome. I remember a few years ago hearing about a similar program being done in California and thinking how great it was and a little jealous of it. So it's really awesome that something similar about a conscious retailer is being done here in Ohio. The numbers you shared, Tristyn, at the beginning, looking at the different number of advertisements in the windows and on the sides of the different zip codes, you know, like 15 ads compared to 3, and then the pics showing what the outsides of those buildings look like, you know, is pretty astonishing. And I think that also is kind of a great follow-up from what Dr. Haskins was talking about yesterday, and just the disparity of liquor stores and retailers in the different socioeconomic status areas. So that's all really just interesting stuff. A number of questions coming in. Okay. I think first was people said, sorry if we missed it, but how is this initiative, and I think the coalition as a whole, funded?
Okay, so the coalition, we are actually a drug-free communities federally funded coalition. So because this is inclusive of tobacco and alcohol as well, we are able to use some of those federal funds to fund this initiative. We're able to use some of our gambling funds that many counties have, again, to fund these initiatives, focus more on the lottery piece of it. And then we have local levy funding, which I know not all counties have that luxury, but we're grateful for the resources that we have to be able to do that. So a little bit of everything.
Great. What percentage of retailers are involved in the Platinum program in Montgomery County?
So right now, 0. Just given the fact that we're starting out in Dayton, if I went out to Centerville or Oakwood, I would probably be able to get many very quickly. But in the city of Dayton, 0 at this point.
What kind of follow-up do you plan on doing to ensure that they are following the expectations? So is it a one-time visit? How many times do you plan, or does the coalition plan to go back to make sure that the respective retailers are maintaining their bronze, silver, gold, platinum levels?
Yeah, so that's actually one of the reasons we decided to make sure that we were using a provider for this, and that it wasn't necessarily going to be sustainable with just volunteer coalition members. And so they will be getting at least monthly visits to make sure that, they're walking in and that the store hasn't been plastered with advertisements, which is something that the Food Equity Coalition had dealt with. As they were trying to rearrange stores, they would go back and everything had been moved. So yeah, monthly.
Okay, great. I think something from like a question of mine and interest is, can you share a little bit about the beginning conversations and discussion with the coalition? Because this is, I mean, I know that the Montgomery County Prevention Coalition is large. Up in Cleveland, there's a smaller and gambling specific coalition called the Cuyahoga Problem Gambling Coalition. I'm just curious how, when this idea started, what that conversation went like, what the interest or like buy-in from the entire coalition, because obviously the entire coalition is prevention. I know you have a gambling subcommittee, what like the buy-in was for them, because obviously a lot of effort has gone into this. And also their kind of comfort level or of interest in doing those community scans and going out and having conversations and taking pictures of places. Just how did all that kind of come together?
Okay, so that's, I think, a lot of questions in one, and I'll try to answer that quickly. But there's a lot of backstory. So, what's that?
We've got some time.
Okay, so what had happened was in like early spring of 2019, there was I'm part of all of these different coalitions because I'm always looking at ways to collaborate with other coalitions. And he's now the president of our coalition, but he was a former city planner. He retired from that, bought a bakery in Old North Dayton, and he had his bakery right across the street from a Family Dollar. And the Family Dollars in the city of Dayton, and I'm sure many of you have seen this, are trying to get liquor permits. And what they were finding was that, the amount of police calls that they had, the amount of just criminal activity going on in the parking lots. You couldn't see inside any of these places. So what we ended up doing was I partnered with him, and we went and testified in front of the Liquor Commission to just educate them about, the potential harms of granting more liquor permits in these areas, right? Well, what ended up coming from that was the fact that, the liquor permit was a very small part of this. We were seeing a lot of criminal activity, not only in dollar stores, but also in some of these areas around these convenience stores. So this was something that was well known. We didn't have to develop community readiness for this. So we started looking at, okay, what can we do about this? Do these stores want to have these predatory practices? Do they want to be good neighbors? Do they not know any better? What's going on here? So that's when we really brought the coalition together, the alcohol committees, those individuals working on tobacco, which is a separate coalition, as well as our gambling committee of the coalition as well. And we started brainstorming, what are some practices we can implement? And it took off. People got really excited about this. I think it's the fact that, there are so many environmental prevention practices in one, and it's kind of unique. So I will say the buy-in, we got individuals joining the coalition because of this. In terms of them looking at the environmental scan piece, I think the timing just with COVID was a very, I hate to say opportune time, but individuals had a lot of downtime. And they were able to just hop in their cars, stay in their cars, and do these scans. All of our prevention providers are part of the Prevention Coalition. So given the fact that they were able to really utilize their time, was really helpful for that. And again, we had it got to the point we had 361 locations, and I had providers reaching out and they're like, all right, I'm ready for more. And I was like, I literally have no more locations for you to go to. But it was really great to be able to see just the buy-in and the readiness in the community.
Yeah, that's fantastic. So you might be able to comment on this. It's a question from Zach, and Zach, we can link you with Karen Russo at the Ohio Lottery. So if Derek or Cheyenne can maybe put her email in the chat again. But Zach's asking about, any other higher up or higher level ordinances than just the local ones. So what kind of checks and balances from the Ohio Lottery take place when it comes to how many signs possibly the Ohio Lottery Commission allows for the retailers to display? Do they have any sorts of audits or checks and balances on the signage and advertisements? So I don't know if you can answer that, if you know any of that information from working with the lottery. But then Zach, I know Karen is not with us today, but can absolutely comment on that if you want to reach out to her.
Yeah, so that's actually one that I would love to know the answer to. Something that I've talked with Karen about is just, is there any level of like adherence to a standard around kiosk monitoring? Because we were seeing like kiosks were in the back of the stores where nobody could see them. And she had said, yes, the clerks need to have those kiosks in a place that is visible. In terms of advertisements, I mean, you guys can see from the data, it varied significantly from community to community. I will say it wasn't as prevalent as, tobacco and alcohol, which, is privatized and very competitive. So I think that there's a benefit there, but I don't know of any real regulations around the advertisements.
Okay. Yeah, and I think we can, maybe we can help get some of that information out for others that are interested in that, because Karen would be able to comment on how often they check or what their rules or regulations are on that. I'm also curious if there's a group called NASPL, which stands for the North American Association of State and Provincial Lotteries. And they publish actually a lot of responsible gambling and gaming newsletters and magazines and stuff like that. So so by North American Association, so it's the state lotteries of the United States, but also the provincial lotteries of Canada. So you might think this group might be headquartered in New York or Washington D.C., but they're actually in Concord, Ohio, which is a few miles to the east of downtown Cleveland. So if you're not aware of that group, I'd be happy to link you with them as well, because I'm sure they'd love to hear more about this, not only because they promote a lot of responsible play within state lotteries, but also because they're based here in Ohio. So I'd love to make that connection.
Absolutely. That's incredible. I had no idea.
Yeah, absolutely. Let's do that. And another question's coming in right now. After a site reaches platinum status and gets the billboard for achieving this, what happens to incentivize the business further? Do they get the advertisement on a recurring basis to keep them compliant? If not, maybe offer small business tax breaks or incentives?
Yeah, we haven't had that happen yet. So that's a very ambitious question. Enrollment is a year long. So actually, like, now that I think about it, we could do, one incentive per quarter, ending with that, which would be a good idea. But, obviously if they're platinum and they get rid of everything and, revert back, the next year they would be able to re-enroll. We would hope that wouldn't happen, but it may be advantageous to space that out by quarter.
Good thought. That's the end of questions coming in for the inside of the Q&A. We can look back through the chat, please, everyone. We still have some time, so if you have further questions or comments. But inside the chat, Tristyn, a lot of fantastic information. Great program. Great presentation. Great numbers. Corey or Derek, any thoughts on your end?
Yep, just a couple of points related to just to tie in with local retailers, that I think that's such an important piece. And I can't speak to the amount of times that the lottery goes and kind of checks the locations, but from what I'm aware of, there aren't any requirements as to the number of advertisements that a store could place. And many of that's based on local rule and local ordinance. So make sure you know what your local ordinances are, because if you have them but they're not enforced, then they're not very good. And if you don't have them, then that's a great advocacy opportunity to really look into, not only from the lottery side, but from alcohol and tobacco as well. And I think it's also, as you're working with those local retailers, such a great opportunity to tie it into the Play It Safe program that's offered through the lottery. And Karen has resources that it's available, and I put her email in the chat. So if you'd like some Play It Safe materials to share with your local lottery retailers, connect with Karen and she can help get those materials to you, because it really is such an important partnership to make sure that we have strong engagement with those retailers, particularly related to underage individuals. And I'm glad that, Tristyn, you're having conversations with Karen about visibility in those retailers, because it was always a pet peeve of mine at my local Kroger that the self-service kiosk was at the front of the store, but to the backs of staff, and they've since moved that to right next to the customer service desk. And I think that's an important step, and just allows for those opportunities. So that's all that I wanted to mention. If you do have questions, feel free to ask that in either the chat or the Q&A section. We are going to we got about 12 more minutes on the clock today for this session, and then we'll be joining back at 1 p.m. To hear from Mr. James Syfax with Prevention Action Alliance and learning about cryptocurrency and online gambling.
And we have another 2 more questions coming in. Tristyn, did you find any connection between amount of advertisements and food deserts? Just wondered about this indifference to the poor neighborhoods factor.
I love that question. So my dissertation is actually on food access. So this is perfect. Yes, overwhelmingly. And I think, if anyone's familiar with the social determinants of health, we can really see the way that, the layers of disparities really are compounding in those areas. I was very upset that I left out one of the slides that actually shows the area that has the second highest rate of advertisements also has the second highest rate of substance use disorders, second highest rate of mental health hospitalizations, just all of these different things, and obviously in a food desert. And then, you look at those lower advertisements, and then you're seeing, the best possible outcomes in terms of behavioral health. And that's not surprising. And I will say, correlation and causation are not one and the same, but when we have research to support the fact that, those issues really build upon each other and then create the disparities, that's really what we're focused on, and why we're partnering with the Food Equity Coalition to make sure that, those corner stores, are promoting positive behavioral health as well as impacting and improving food access as well.
Thank you. I'm also curious about a little more about, again, just the involvement of coalition members kind of getting prepared to go out, and if, again, they are walking into a retailer to have a conversation, any training involved in that? Did you maybe have, specific talking points for the coalition members to have or run off of, and is that done inside of a coalition meeting before they go out, or just emailed out? Because again, being part of the smaller gambling coalition up in Cleveland, just kind of looking at ways to be more actionable. So I'm curious just how the preparation was for some of the coalition members to go out and have these conversations.
Yeah, absolutely. So the levels of comfortability in engaging retailers varied. So police officers were very comfortable. What they weren't necessarily comfortable with was speaking to the behavioral health piece of it, why we're doing this in terms of youth initiation of substance use. So we actually created just a one-pager that outlined, some talking points, but that they could leave with, that they could actually leave with, the store manager, store clerk, whoever it may be, But we had those conversations. You know, some people are very extroverted. They want to go and they want to talk and they feel very comfortable. Other individuals, they definitely benefited from having that outline. So, and I can send that out. And I'm serious for anybody on this. Feel free to reach out to me. I'm happy to share any and all of our materials with you. I'm happy to have some conversations about if you want to get this into your community, what that looks like. And if you want to scale it, maybe some ideas on scaling as well.
Great.
I had a question related to just this initial outreach. Is it easier to engage some small, like mom and pops, or the bigger companies? Like, what would be your best recommendations?
Yeah, we actually only have engaged small local stores. We wanted to make sure that we were giving locally owned businesses the opportunity to benefit from this before, you know, you go out to like a Speedway or another corporate entity, just because we know that those places have the resources to provide that support. And if they're not adhering to those protocols, it's probably because they just don't want to, rather than the fact that they need support and resources. So in the future, we may engage some of those larger corporations. That's just not our priority right now.
Thanks.
Yep.
Right. And a question / comment from Blake, and maybe this is a phase 2, but this is a great point. This is interesting, as I have a client that I see for treatment and their game of choice is Keno at a local bowling alley. I'm thinking about how entertainment venues and restaurants that serve alcohol and provide lottery tickets and other opportunities to gamble might benefit from a program like this.
Absolutely. We have a program in Montgomery County where we actually do outreach with bars, and we do some training for bar staff. That's not where we are right now, but certainly that's a great idea. And I think that that could maybe be our 2.0 version of the community conscious retailers, and a great opportunity to like get this out and expand it, you know, in some of those places where high risk behaviors take place.
Yeah, and I think I'll throw even a phase 3 at you as Ohio prepares for legalization of sports gambling. Not only may places like bowling alleys or other places like that, you know, move from just having lottery products to sports gambling, but VFWs and fraternal organizations are going to be trying to be involved in that as well. So when you're looking at, you know, risky behaviors of gambling and alcohol, but also with more at-risk populations like veterans, you know, community conscious VFW would be a heck of a thing. So that I think this could be taken so many ways.
Absolutely.
Corey or Derek, were there comments to kind of end out the session? Actually, another question's coming right in. It's from my father, Ken Bazzelli. Great information. And he was a UD student, and accessibility of alcohol and gaming with university students located in the Oakwood area and downtown. And he remembers that from his days.
Absolutely. Yeah, it's interesting once you cross that Oakwood border, it's like everything kind of goes away. But I will say on campus at UD, those gas stations are, you know, some of the worst when it comes to the amount of advertisement they have in their storefronts.
And then maybe lastly, how could this work with a drive-through? So I guess that's maybe commenting on like the drive-through liquor stores and places like that.
Yeah, so they don't necessarily have the windows. We've talked about it. Well, some of them do have storefronts. They're kind of like combinations.
Mm-hmm.
So we haven't had any full drive-throughs that have been engaged in this quite yet. But what we plan to do, you know, if you don't have windows, then you know, that's something that we're not really going to include in that. But that platinum level looks at the entire storefront, right? So we have these brick structures that have very little windows that are absolutely plastered. And so we want to decrease the amount of signage on the actual building. Most of the other interventions are still applicable in terms of drive-throughs.
Great, thank you.
Yep.
Great questions and chatting throughout the session and near the end to all our attendees. Great discussion. And I'll turn it back over to Mr. Brown.
I had another question actually before you go, Tristyn. I was thinking about, because I know that Montgomery County Prevention Coalition has a lot of capacity, and I'm just wondering if you had any advice for maybe smaller coalitions who might not have as much capacity, whether that's financial capacity or even, you know, human resources, to implement something like this in their area.
Yeah, so my biggest thing would be develop the relationships with your business associations, your Better Business Bureaus. We developed a relationship with our Better Business Bureau early on, which was really helpful. Knowing that the incentive piece and the financial support may be a barrier. I will say if you're not connected with your Drug-Free Communities Coalition and they do receive funding, please connect with them. This is a great opportunity to be able to do some work that looks at both substance use, tobacco use, and gambling, and being able to have a preventative approach to all three. They all just fit nicely with one another. But developing those relationships, and I will say there are some retailers that want to do good work. I think so often we just think that they're completely worried about profits, and to an extent they are, but they also live and work in these communities, and they want them to be healthy